It's my pleasure to introduce our last speaker from Jordan, Dr. Khalil Al-Salem, speaking about plasma exeresis after blepharoplasty.
Thank you, Dr. Assam, for the introduction. Let me just share my slides, please. I'd really like to thank the Qassimi group for the kind invitation. My name is Khalil Al-Salem. I'm an associate professor at Mota University. I'll be very happy to share some of my humble experience in using Plexr or plasma exeresis following blepharoplasty. I have no financial interest in my work. We'll start with what's Plexr or plasma exeresis. This is a cordless surgical, let's say, soft surgical device that conveys high energy to a localized area of skin. Usually it's a small lightning, and it causes the skin to evaporate. So the solid will be converted into vapor through a process called sublimation. The procedure is simple. I use anesthesia around 10% xylocaine only, and I've been using plasma exeresis since 2016 when it was first introduced to Jordan. So whenever you are starting something, you just go by the book. So this is one of my first cases ever done, or I ever did. So you can see that there's no real change other than you know, the skin became a little bit more smoother. And once I started practicing more plasma exeresis, I started to notice that whenever your spots are very far away from each other, you won't really get the desired, let's say, outcome that the patient wants and you want for the patient. This is another case that I first did. You can see that the wrinkles or the rides has decreased a lot after the session. However, the patient didn't have the outcome that she was looking for, like, for example, getting rid of this the skin. This is another case also that I did far back in 2017. You can see that the lower lid rides has disappeared after Plexr, but still there's a skin fold. And that's because it was more or less superficial, and as I've said, the spots were a little bit far away from each other. Plexr, also I've used Plexr to get rid of let's say dark circles. However, it's a big no for me now, especially in our race. Plexr can induce a lot of pigmentation post-op, which I had really time treating. Some patients, it took me between 8 months to 1 year for the spots to resolve. So once I started actually using Plexr more deeper, and the spots were more or less adherent to each other, I started to get better results. This is a patient with a primary soft surgical blepharoplasty. You can see this is the pre and this is the post-operative picture. This is another case where you can see that the skin fold has disappeared after using the same method. This is a third patient. You can notice the skin fold here. So this is her before, this is after the operation, and this is her after 2 weeks. But you can see the patient had some pigmentations. These actually disappeared after 3 months. This is another patient whom she had excess upper eyelid skin. She wasn't really very happy or keen to go to operation. And I did for her a plasma apheresis, as you can see here. This is the, let me show you the picture. This is the excess skin that she had, and this is the laser, let's say, spots being laid down. And this is another picture showing the preoperative and postoperative plasma apheresis. This is another case where you have where plasma apheresis was done for the lower lid. So I started to work on post-operative blepharoplasty cases, and I found that it's a great device to remove extra skin, unwanted skin folds that develops after suturing, any skin tags that can't be removed by surgery, and it can smoothen up the skin piece, especially if you have a mild brow ptosis. So let me show you some pictures. This is a patient I did for her upper lid blepharoplasty. Still, she has wasn't really very happy about the uneven arc of the upper lid. So I did for her Plexr, and this is her look after getting rid of the upper, smoothing up the upper lid crease. Another picture of the same lady. This is her preoperative, this is post-op. She wasn't happy about this small skin tag over here. And this is her after doing one session of Plexr. This is another patient who was referred to me by a respectable colleague. So the patient was very unhappy. She had this small skin tag over here, and this skin, excess skin over there as well. And this is her after having the operation directly, immediately. And this is the other eye. You can see the excess skin tag here, which was removed by plasma apheresis. And she turned happy. Another case where I combined both, surgical with the soft surgery or plasma apheresis. This lady had an upper lid blepharoplasty with one session plasma apheresis. You can notice that the rights or the wrinkles has disappeared, along with the but she had few skin wrinkles that I had to do another session for her. And she developed some small pigmentation that disappeared afterwards. I've noticed that young patients, dark colored, those with freckles on the hands or the face due to sunburn or sun injury, were more likely to develop freckles rather than the other people. So this is another lady. She wanted to have rapid recovery because she's an employee. So I did for her upper lid blepharoplasty and lower lid plasma apheresis. And this is her picture immediately after the, let's say, the operation. And this is her picture after 5 days. So you can notice that most of the burns have, disappeared, and she can go back to work very rapidly. And this is her after 6 months. This is another lady I did for her upper lid blepharoplasty with lower lid plasma apheresis, and this is her post-operative picture. She wasn't happy about the lower lid pigmentation that we had really tough time treating. Another lady with multiple suture bumps and lumps that was referred to me by a respectable colleague. So I actually removed them using plasma exeresis as well, and the patient had a smoother surface. Plasma exeresis, I've tried actually using plasma exeresis on xanthelasmas, and there is recent quite literature on it. So you can see this is the before, this is the after picture, and this is the patient after 2 months. So why plasma exeresis? Well, for example, if you have a case like this one, you will hate actually going to surgery. You will hate really operating on such a patient. But with plasma exeresis, the nice thing is that you try your best to remove as much as you can, and the sessions are repeatable. This is here after, one session. As I got more experience with those cases, I found that you really need to go deep, and you have to go up to the orbicularis muscle. You have to remove all the yellowish area because recurrence is high, and things, or let's say these lesions recur not because you have missed some of them, or let's say missed part of them, but rather the patient has this propensity, they have, the thing to develop those lesions. And this is here after 3 sessions, actually, 1 year after. 1 year later. And Plexr can also remove warts that you really don't want to remove them during surgery. This is the before and after picture. Multiple walls also easily removed by Plexr as well. And even you can remove tracheoepithelioma, the tidal marks. So you can see this is the before, this is the after picture. And I did another session to remove this area here as well. This is a gentle lady also. She had multiple tracheoepithelioma all over her face. And we've removed the smaller ones over here. And then she was a little bit more encouraged to remove the larger ones. And thank you so much for your time. Thank you. Any questions? No comments.
Thank you very much. Great presentation. So may I ask questions? Mike, Milan, can I ask a question?
Yeah, go ahead.
Thank you, Dr. Al-Salem. Great presentation. Actually, it's a new topic in oculoplastic, so it was really interesting to see your results. So, to me, Plexr is addressing just the ocular surface, not the other senescent changes like fat prolapse or brow ptosis or other things. So I would like to know the indications for Post-blepharoplasty. What's your indications? How do you choose your patients?
Well, first of all, if we are dealing only with dermatochalasis, then Plexr might do the job. However, if you have brow ptosis with it, you have a fat prolapse, ptosis, for example, all these won't be addressed by Plexr. So I would really urge the patient to go to surgery. But I found that, to get a more effective, let's say, post-Plexr result, it's important to be deep. You have to go beyond the dermis, because you won't be able to induce a structural change. Otherwise, you're just burning the skin. So you have to be deep. The lines should be, your spots should be very near to each other, so that as if you are brushing the area. That's, that's much better than, just doing those spots all over. And you won't really get a good result. The patient won't be happy.
Actually, your results were fantastic. So I would like to make a comment, if I'm allowed. So I've seen patients that has actually done Plexr, referred to me after the Plexr for eyelid retraction. And so I checked these patients and found that many of those with the periorbital Plexr, all of them had lower lid laxity. So to me, if the patient has lower lid laxity, I think it's not a good idea to go for the Plexr before the correction of that laxity. So I'm not sure what's the idea of the other colleagues, Milan, Mike, and Dr. Essam El-Touki about the Plexr.
I don't have much experience actually with it.
Same with me, Farzad. No experience with Plexr, but it was a.
Dr. Mike would really love the device once you buy it. You know, it really saves you, because you know you really get all of those patients. They're very unhappy about, I have a little bit here, a little bit there. You don't want to get them back to surgery, so you can just let's say redraw the eyelid with Plexr, and it really helped me to get better reputations, among my patients and doctors.
Mike, you are muted.
How do they respond to the hyperpigmentation and the length of time to recover? It seems like in patients that have a Fitzpatrick type 3 that are Asian or Middle Eastern, it would be really problematic.
Well, I totally agree. You have to prepare your patient for, the surprise. You have to tell them that pigmentation is really highly, it might occur, and especially those who can develop freckles after, after exposure to sun, or if they were young, if they were heavily pigmented, for example, African, dark, that dark. But, mostly it's not that bad. Most of them, they will recover within 3 months, I guess. And pigmentation, I say it's only 10-15% of the whole, whole of my cases that I did. I did over 1,500 cases of Plexr between surgeries and primarily, doing the thing. So, or let's say soft surgery. So yes, I, had this problem. However, you just give them, for example, ointments like Optim Eyes, eye revitalizer, something that will just, or dark spot eraser, something that will get rid of the dark spots.
Thank you. So we have just 2 minutes from now. I would like to ask a question from Mikey from Alod by Mike and Milan and Dr. Essam. May I ask a question?
Sure.
I just need to discuss with Milan that
yes,
probably in the last few years, I've been